Hello to everyone. I'm Andrii Dinets. I'm a surgeon. I'm a member of the interdisciplinary military research group from Ukraine. I would like to thank you, organizing committee, to present our study today to you about the possibility of using minimally-invasive surgery, laparoscopic and video-assisted thoracoscopic surgery for the management of the patients at the level 2 field hospital. How to change the... Huh? Oh, yes. Yeah, this study is dedicated to all fallen medics in this war, and I have nothing to disclose. I would like to start first to introduce how the medical evacuation system looks in Ukraine nowadays in the ongoing war. We have various hospitals depending on the distance from the front line. We have level 2, level 3, and level 4. We also follow the principles of the NATO guidelines. We use the platinum minute on the place of injury and the golden hour for transportation of the patients as soon as possible to the high level of the medical care. It used to be a helicopter up there, but we stopped using any avia evacuation, because Russia basically shut down all our vehicles, and it's a high risk for transportation for both crew and for the medics. Therefore, we use only ground transportation. And because of these circumstances, it's the high risk to lose our patients during the ground transportation, which is also under the risk of the using the high energy weapon against us. So what we experience here, Russia used basically everything they have. It's the high energy weapon, all kinds of ballistic rockets, multiple large rocket systems like Grad, Smerch, etc. They can send these rockets over 40 and 60 kilometers from the front line, from their side, and they put it not only to the military units but also to medical facilities and civil facilities as well, which also increase the risk of the medical aid. Therefore, we considering all those experience after the February 24, 2022, we have reconsidered the features of the management at the level 2 hospital. So we have a surgical beds, which is in contrast to the current NATO guidelines. We continue to use damage control surgery. We have blood products transfusion, X-ray, ultrasound, and we will use all those things because, as I said, it's the high risk of the evacuation of the patients from the front line. Laparoscopy and video-assisted thoracoscopic equipment is also available. It's not available everywhere. It depends on the medical resources in each particular hospitals, but in some cases, we start to use it routinely. Another important feature from this war is the possibility to convert a level 3 hospital to level 2 hospital, depending on the front line moving, because in some aspects, the front might move forward, and therefore hospital 3 level become actually on the distance of the 20 to 40 kilometers from the front line. Here's the scheme and the possibility to use laparoscopy and video-assisted thoracoscopic. Again, it depends on the medical resources, and unfortunately, we have limited resources in most of the cases. So the aim of this study was to show a specific feature of war surgery at the level 2 hospital in the ongoing Russo-Ukrainian war, to investigate and evaluate utility of the laparoscopic and video-assisted surgery, as well as application of magnetic tool to treat our patients. For this study, we identify 56 male combat patients within the first days of the war since February 22. All those patients had a gunshot thoracoabdominal injury after the application of high-energy weapon, and they were all treated at level 2 mobile hospitals in the area approximately 20 to 40 kilometers. It's 12 to 24 miles from the front line. At these hospitals, we had an X-ray, and we have a special minimally invasive equipment. Also, we have applied the surgical magnetic tools, which were designed and manufactured in Ukraine. Damage control surgery and damage control resuscitation is a routine approach for such kind of patients. Results. Video-assisted thoracic surgery was performed in 36 patients, and we use this method to remove metal foreign bodies from the body to treat coagulated hemothorax and to suture lung wounds. The thoracotomy and laparotomy simultaneously were performed in 20 hemodynamically unstable patients. And in most of the cases, we had a hemorrhage from the liver, which were sutured, as well as perihepatic gauze packing was also considered. One of the problem is the multifragmental injury of the patients because of the shelling, and we use laparoscopy to remove large fragments larger than 1 centimeter in the diameter in 41 patients, and then multiple fragments were also removed in the minority of the patients, as shown at this slide. We try to use a multifunctional magnetic surgical tool to remove magnetic fragments under the guidance of the laparoscopy or thoracoscopy device, depending on the localization of these fragments. Here is the example of the typical patients. We have an inlet hole, and we frequently use inlet hole as a port for thoracoscopy or for laparoscopy, which is useful to further remove those fragments. An X-ray was performed, and the foreign body was identified as shown on figure B and C. Then we apply a C-arc. Under C-arc guidance, actually, we identify those metal fragments. Then we insert a magnet on the thoracic cavity. Then, using the magnet, we rotate this metal fragment in the position that would be easy to remove, and we actually remove it here. This is a post-operative figure showing the magnetic tool and removed shell after the damage. Here is the video showing. So at this video, you see this is abdominal cavity. To the left, we have a magnetic tool which catch the bullet. I guess it's from the Kalashnikov gun machine, and then this bullet was removed from the body, and the liver was sutured. As a conclusion, we would like to stress that the ongoing Russo-Ukrainian war is associated with severe injury, and it's something new that we faced since maybe World War II. Russia uses all possible kinds of high-energy weapons, and it's quite difficult to resist to those weapons. Minimal invasive surgery is possible to apply on the level 2 field hospital, despite the risk of the artillery strikes on those short distance, but we have no other choices actually to save our patients. Surgical magnets, useful tools for the removal of those fragments. And considering our experience and this study, we also think that it's important to propose to update the current military medicine NATO guidelines for the management of the patients, considering the conditions of this war. Here I would like to acknowledge other group members. All those doctors on duty unfortunately cannot come over here and present the studies. The Major General Igor Lurin is the research group leader. We try also find the time to do a research and to identify specific features to further improve the quality of the medical care for our soldiers. And as a future perspectives, we would like to have a request for international research collaborations. We would like to find the collaborators for basic and translational studies in this war, and I would be happy to share the contacts. Here is the QR code for our list of publications. We try to publish as well, despite all those circumstances in the Ukraine. And although it's difficult to fight with Russia, Ukrainians want to live in an independent country, and we hope for the victory. Thank you very much, and I would be happy to answer any questions.